Hello, I'm Dr. Jocelyn, urologist and pelvic surgeon with over 15 years treating men's most intimate health battles. And what I'm about to tell you could save your sex life, your sleep, and your dignity. Every single day, I see men in their 60s, 70s, even 80s walk into my clinic. Some are in tears. Others won't even make eye contact. They all tell me the same story. Doctor, I thought this was just part of getting old. But here's the truth most urologists won't say out loud. In 87% of cases, their suffering was completely preventable. Yes, you heard that right. Most prostate problems aren't caused by aging. They're caused by mistakes, daily habits, things you do every morning without realizing you're destroying your prostate from the inside out. Today, I'm breaking the medical silence. I'm exposing the 10 deadly mistakes that turn your prostate into a ticking time bomb. And listen carefully. Mistake number 1, the one I'll reveal at the end, is committed by 9 out of 10 men every single morning. It alone can triple your risk of prostate disaster. But first, let me address the question everyone's thinking. What about masturbation? Here's what the science actually says. The latest studies from Harvard and Mayo Clinic confirm regular ejaculation, whether with a partner or alone, can reduce prostate cancer risk by up to 30%. So no, masturbation isn't destroying your prostate. In fact, it may be protecting it. But here's the catch. Healthy sexual activity will not save you if you're still making the 10 mistakes I'm about to reveal. If you've ever felt like your urine stream is weaker than it used to be, if you constantly feel like you didn't fully empty your bladder, type present in the comments. I read every single one. Now let's begin. Mistake number 10. You're afraid to drink water. This one seems logical, but it's killing your prostate. Men think less water equals fewer bathroom trips. Wrong. It's the exact opposite. When you intentionally dehydrate yourself, your urine becomes thick, acidic, and highly concentrated. That concentrated urine is like pouring acid directly onto your prostate. It irritates the bladder lining 24 hours a day. Your prostate reacts by swelling, becoming inflamed, and growing larger. It's a vicious cycle. Less water leads to more concentrated urine. More concentrated urine leads to more inflammation. More inflammation leads to more urgency. And that makes you drink even less water. I had a patient named Roberto, 68 years old. He drank 1 glass of water a day. 1. His prostate tripled in size in just 3 years. When we increased his water intake to 1.5 liters per day, his symptoms improved by 60% in 6 weeks. The fix. Drink 8 glasses of water every day. Small sips throughout the day. Stop drinking 2 hours before bed. Your urine should be pale yellow to clear. If it's dark, your prostate is in danger. Mistake number 9. You're sitting on your prostate. If you sit for more than 2 hours straight, you're literally crushing your prostate under your body weight. Sitting cuts off blood flow. It reduces oxygen delivery. It increases toxin accumulation. It weakens your pelvic floor muscles. And weak pelvic floor muscles lead to post-urination dribbling, leakage, poor bladder emptying, and embarrassing urgency episodes. Men who sit more than 6 hours per day have a 40% higher risk of severe prostate enlargement. I treated a retired accountant who sat 10 hours a day. He urinated 15 times a day and 8 times a night. We implemented what I call the 30-2 rule. Every 30 minutes of sitting, stand up for 2 minutes. In 3 months, his nighttime urination dropped from 8 times to 2. The fix. Set a timer every 30 minutes. Stand, stretch, walk, squat. Your prostate will thank you. Mistake number 8. Your morning coffee is torturing your prostate. I love coffee too, but here's what caffeine does to your prostate. It forces your kidneys to overproduce urine. It creates sudden bladder spasms. It tightens the bladder neck, making it harder to empty. I had a patient named Pedro, 72 years old. He drank 5 espressos a day. He woke up 12 times per night. We reduced him to 1 morning coffee. After 2 weeks, he was down to 3 nighttime trips. The fix: max 2 cups of coffee per day. 0 caffeine after 2 p.m. Replace with prostate-friendly teas like nettle or sage. Mistake number 7, you're eating inflammation in a package. Processed foods are biochemical landmines for your prostate. They increase DHT, the hormone that enlarges your prostate. They cause massive fluid retention. They trigger systemic inflammation. They introduce cancer-linked preservatives like nitrites. I had a patient named Jacobo, 66 years old. He ate chorizo every single day. His prostate weighed 80 grams, double the normal size. After we removed processed foods from his diet, his prostate returned to near normal size in 6 months, and he lost 12 kilograms. The fix? Eat tomatoes for lycopene, broccoli for sulforaphane, pumpkin seeds for zinc, wild salmon for omega-3. Mistake number 6. You're holding your urine like it's nothing. Every time you ignore the urge to urinate, you're destroying both your bladder and your prostate. Holding urine overstretches your bladder muscles. It decreases elasticity. It increases residual urine. It increases infection risk. It compresses the prostate and causes chronic inflammation. I had a patient named Enrique, 70 years old. He would hold his urine during his 4-hour domino games. This resulted in full urinary retention. He needed emergency catheterization. The rule: when you feel the urge, you have 15 minutes maximum to empty your bladder. Mistake number 5. Every cigarette is assassinating your prostate. Every single cigarette restricts blood flow, increases prostate inflammation, introduces cadmium that accumulates in the prostate, damages prostate cell DNA, and doubles your risk of aggressive prostate cancer. I had a long-term patient named Bernardo. He smoked for 40 years. He developed metastatic prostate cancer. Quit today. After 3 months of no smoking, prostate inflammation drops by 40%. After 1 year, your cancer risk dramatically lowers. Mistake number 4. You're ignoring the one test that could save your life. This is the deadliest mistake. Skipping prostate evaluations after age 50 is like playing Russian roulette with your life. Prostate cancer kills 1 man every 17 minutes in Latin America, and 90% of those deaths were preventable. A rectal exam takes 30 seconds. A PSA blood test can detect cancer 10 years earlier. I had a patient named Miguel. He waited 5 years despite symptoms. He arrived too late. Stage 4 metastatic cancer. Schedule your prostate exam this week. Your pride is not worth your life. Mistake number 3. You're eating too much red meat. More than 3 servings of red meat per week increases prostate inflammation by up to 40%. High-heat cooking creates heterocyclic amines, cancer-linked compounds that attack prostate DNA. Processed meats are even worse. I had a patient named Andres. He ate grilled meat every single day. His PSA was 15. Normal is 4. After switching to fish 4 times per week, his PSA dropped to 3 in 1 year. The fix? Limit red meat to once per week. Replace with salmon, sardines, chicken, legumes. Mistake number 2. Your belly fat is a toxic hormonal organ. Belly fat isn't just fat. It's a hormone-producing factory that destroys your prostate. It releases inflammatory cytokines. It increases prostate swelling. It converts testosterone into estrogen. It reduces libido. It weakens erections. Every centimeter Over 94 centimeters waist circumference increases prostate risk by 15%. At 102 centimeters, the risk doubles. I had a patient named Jorge. He lost 15 kilograms in 6 months with intermittent fasting and daily walking. His nighttime urination dropped by 50%. Mistake number 1. Stress is silently destroying your prostate. Here it is. The mistake 95% of men commit every single day. Chronic stress floods your body with cortisol. It crushes testosterone. It increases DHT. It tightens pelvic muscles. It irritates the bladder. It creates hyperactive bladder. It worsens prostate inflammation. Stress alone can triple nighttime urination. I had a patient named Juan Pablo. He practiced 10 minutes of coherence breathing every morning. Breathe in for 5 seconds, breathe out for 5 seconds. He meditated for 10 minutes at night. He took 400 milligrams of magnesium before bed. After 1 month, his bathroom trips reduced by 70%. His sleep was restored. He told me he felt 10 years younger. Your 30-day prostate rescue protocol, week 1, emergency. 8 glasses of water daily. Stand every 30 minutes. No caffeine after 2 p.m. Measure your waist. Week 2, intensification. Eliminate processed foods. Practice coherence breathing. Urinate immediately when you feel the urge. Schedule your prostate exam. Week 3, transformation. Red meat once per week. Intermittent fasting, 16-8. Zinc, 15 milligrams. Magnesium, 400 milligrams. Vitamin D. 30-minute daily walk. Week 4, consolidation. Track your weight. Track your bathroom trips. Meditate before bed. Celebrate your progress. Men who follow this plan see 50 to 70% improvement in symptoms within 30 days. Final message. Your prostate is not doomed. Your age is not the enemy. Every one of these mistakes is a choice. And now you have the power to choose differently. I've seen men in their 80s achieve the prostate health of men in their 50s. I've seen families restored, confidence rebuilt, dignity reclaimed. But I've also seen the other side. Men who ignored the warnings and now live with catheters, surgeries, or worse. Your next 24 hours determine your next 10 years. Subscribe. Share this with every man over 50. Comment which mistake you'll fix first. I read every message. And remember, take care of your prostate, and it will take care of you. See you soon. In the next video, I'll reveal the 7 superfoods that rejuvenate your prostate by 10 years.